If you are among the more than 100 million Americans who need corrective lenses, you've probably dreamed of being able to throw away the glasses or contacts for good. Well, Dr. Nancy Snyderman has an eye-opening look at a procedure that is making that possible for more people than ever, and it's good to have you here in New York.
It's great to see you, and as you know, for those of us who do wear glasses, and believe it or not, there are now about 500,000 Americans who suffer from vision problems requiring corrective lenses at least some of the time. Well, over the years, procedures have been developed that return the eye to normal vision. But the procedures have been relatively primitive and they haven't worked for everyone. But now they're giving way to high-tech, non-invasive treatments that could someday make glasses obsolete. One that's getting a lot of attention is called LASIK.
I first began having problems with my eyesight as a child. Probably the biggest challenge is when I wake up in the morning just finding my glasses on the night table. If they're not there, I'm in trouble.
45-year-old Jeff Mendel is not alone. Like 25% of Americans, Jeff suffers from myopia or nearsightedness. The myopic eye is slightly longer than normal, so light rays that are refracted by the cornea and lens meet in front of rather than at the retina. The result is that distant images appear blurry. Jeff's myopia is so severe that even everyday tasks become a challenge without glasses or contact lenses.
Hot idea. Business is really heating up for Casey Anderson.
Watch what happens when he tries to play catch with his son Jason. There have been more serious near misses, like when he's driving.
I have had situations where I blinked and had a contact lens pop out. You know, when you're doing 60 miles an hour on a highway, that's a pretty dangerous circumstance.
Okay, Jeff, you want to just take off your glasses?
Jeff decided it was time to throw away his glasses for good and correct his vision permanently. He went to Dr. Martin Fox, a corneal and refractive surgeon who specializes in a completely non-invasive procedure called laser in situ keratoconus, or LASIK for short.
What it is a procedure that allows us to reshape the cornea in a way that is painless, predictable, and precise.
While the procedure has been used widely in other parts of the world for 10 years, LASIK has been used by doctors in the U.S. since 1996. Only 2 months ago, it was approved for use in farsighted patients as well.
In Jeff's case, we're going to be applying excimer laser energy to the center of the cornea to flatten and thereby weaken the optical power of his cornea.
Here's how it works. After an image of Jeff's eye is scanned into a computer to help determine where the laser's corrective impulses will be directed, a thin flap of tissue is lifted away from the cornea. The laser is directed into the exposed surface of the cornea and sculpts it into a normal shape. The tissue flap is then replaced. There is no incision, no blood, no stitches. We were with Jeff on the day he had his surgery. He was completely awake and received no pain medication.
How you doing, Jeff? You're perfect, Jeff. Couldn't be better.
The entire procedure lasted only 20 minutes for both eyes. When it was over, Jeff was able to do something he never thought possible.
I stood up and I could see across the room. I remember reading a clock on the wall.
You see the clock?
10 after 6.
Okay, there you go.
The LASIK procedure isn't for everyone. Those who have pre-existing medical conditions like diabetes are not candidates. And 10% of patients must return for a laser tweaking. Others may experience light sensitivity and discomfort after surgery. It is expensive, more than $5,000 and not covered by insurance. Long-term efficacy results are not in yet because the procedure is so new. But as Dr. Fox explains, for many patients, it's worth it.
They live in fear of losing a contact lens or losing their glasses or leaving the house without their contact lenses or their glasses. This procedure gives them new independence.
1 week after surgery, Jeff Mendel sees 20/20 in both eyes.
It's become what I had hoped it would become, which is an experience that has sort of set me free.
Julianne may be a beautiful and talented actress, but like millions of others, when she woke up in the morning, she was blind as a bat. Until recently, when she decided to try an exciting new kind of laser surgery to correct her vision. And she was so happy with the results, she had her mother do it as well. So please welcome back Julianne and meet her mom, Anne, and the doctor who performed the surgery, Dr. Martin Fox. Welcome to you. Julianne, you wore glasses from the age of 9 years old?
Yeah.
So you were, I mean, that was your life.
Yeah,
you know?
I really couldn't see, not a bit. Oh, there we go, there's some glasses. Oh, there it is.
So why did you decide to have the surgery? Because glasses were really a part of your life at that point.
Oh, but I hated them, I hate them. I don't know anybody who really loves their glasses unless they're like an occasional wear or something. I mean, I couldn't see across the room. I couldn't see 2 feet in front of me. And I was reading a magazine when I was working on a movie, an Elle magazine, and there was an article about Dr. Fox, and I thought, I've got to do this, I've got to do this. This is crazy. And it just changes everything.
And not only did you do it, but you gave your mom the gift.
For my birthday.
For your birthday. Recently?
Yes.
So what made you decide to go for it at this point?
Well, Julie really encouraged me to do it, and I feel the same way as she, that I wore contacts for years, and by the end of the day, your eyes are tired and sore and dry, and the thought of waking up in the morning and being able to actually see across the room was a wonderful.
Well, Dr. Fox, can you explain what you did to these two women?
Sure. What I did for Julianne and her mom Anne is a procedure called LASIK, which I think represents the greatest technological development in the treatment of focusing disorders of the eye, probably the last century. We have a little tape here which will help demonstrate what we do. The surgery is done under topical anesthesia. And we use an excimer laser, which is an instrument that actually allows us to vaporize corneal tissue and reshape it. The cornea is a major focusing organ of the eye, and so by reshaping it, we can allow for correction of nearsightedness and farsightedness.
Is that person sleeping?
He's awake.
No, he's wide awake. With Valium?
The topical drops.
Nothing.
Nothing. Little Valium.
How long does it take?
About 6 to 8 minutes per eye. I can demonstrate a little bit better on this model about what makes LASIK so unusual and unique. We found a way to apply the laser energy without causing any pain or irritation by the use of an instrument called a microkeratome. It produces this little thin cap of corneal tissue which is reflected away when we provide the retreatment of the cornea. In that cap is contained all the nerve endings of the eye. So essentially what we're doing is treating a part of the eye that has no sensation. So there's no irritation, there's no pain. And the effect of the laser surgery in allowing for the eye to focus better stays.
You say there's no pain. I'd like to ask Julianne, is there no pain?
Nothing. You don't feel a thing.
Truly,
honestly.
and swear on everybody.
I swear. It's scary, you know? I mean, kind of people in the audience sort of went like, ooh. The speculum's the scariest part. The thing that holds your eye open.
That's right.
Yeah, everybody hates the speculum.
They warm it up. Oh, they warm it up. Thank you, of course. But how long after the surgery does it hurt then, or do you immediately see clearly?
Well, you know what's interesting is your eyes are kind of watery after the surgery, and they put these plastic goggles to protect your eyes just for 24 hours. But I got it from the table, and I could see the clock for the first time, since I was, I don't know, 5 or something. I could see across the room.
Immediately.
Yeah. It's a little bit watery, but you can see. And then the next day, 24 hours later, you take off your little protective things and you see everything.
Did you toss your glasses right away a day later, Anne?
I didn't ever wear them ever again.
I see.
And once you've done it, that's it? You don't lose it again?
Well, the effect is permanent, but an occasional patient, maybe around 7 to 10%, will come back in about 3 or 4 months for a touch-up or enhancement. And the beauty of this is we can lift this same cap again, add or subtract a little more treatment painlessly.
Now, I'm 46, and I've reached the point where I linger around at the drugstore, the glasses department going like this. Am I a good candidate? And people who, because of age, are getting...
Yes, because what we can do is we can modify the treatment, and this is what we did for Anne. We can make one eye a little undercorrected so that you can read at a distance that you need for work.
Okay, let's get to the heavy stuff. What if you slip?
Well, if you choose the right surgeon, that shouldn't happen.
Can you slip? Can you make someone blind from this?
Well, there's never been a recorded case of blindness.
Never.
That's important. Yes, that's true. That's true. Nonetheless, it is surgery, and I think people have to understand, having any type of surgery that has been designed by men, that there can be problems. But the rate of problems is very, very small. In our series, it's under 1%.
And the price tag?
Yeah.
About $5,000 for both eyes.
Which is not covered by any insurance.
There are occasional insurance companies that do cover it, but for the most part, no. They don't want to know from it because there's so many people who would want it. and they don't want to pay the
And
town.
will you be able to see for the rest of your life 20/20 like that? Not
yes.
that the show will stay on forever.
Well,
Sorry, go ahead. I'm sorry.
we're seeing people that we did about 3 or 4 years ago, and they're telling us that their vision's getting better as time goes on.
Really?
So I think, absolutely. In fact, what we're looking at in the future is moving this technology to the point where we could take a 20/20 eye and possibly even make that eye see better.
But do you guarantee the surgery, for example, once it's done, if it's not perfect, you go back?
Yeah, we have a lifetime commitment. In other words, if anybody, the surgery is done through an organization called TLC, and we offer a lifetime commitment.
Okay, TV viewing audience, do not attempt to adjust your television set because what you're looking at is an out-of-focus image, which was all I could see when I wasn't wearing my glasses. I can hardly even see it now with these things on. Yesterday, I had laser eye surgery, as you know, and when I remove my goggles today, I'm going to find out if my days of wearing these glasses are over. Please welcome back to The View, the fabulously handsome savior, my savior, Dr. Martin Fox.
Yay,
Thank you so much, Dr. Fox.
Doctor, you should know that Lisa was very, very excited yesterday when she left the building, but what was going through your head when you walked into his office?
Well, I was absolutely, absolutely mortified. And Dr. Fox was offering to show me what the procedure was like, and I refused to look at it because I'm the kind of person who can't even watch ER. So I didn't want to know. I didn't want to read anything negative about it.
Were you scared, though?
I was absolutely terrified. Yeah. And Dr. Fox was saying that the anxiety of it was the worst part about it. But
well, I'm like freaking out on the goggles. What's with the funny-looking goggles?
Well, after we do the procedure, we want to make sure that the eye's protected while it's starting its healing. So we put these plastic shields on. They stay on overnight. And then we ask our patients to replace them at bedtime for a week.
Protected from what?
Inadvertent trauma to the eye. We don't want the eye to be bumped or rubbed.
Oh, so it's protecting
So she rolls over and hits a pillow or something like that?
So she doesn't have to worry about that.
Dr. Fox, what would you say? What made me the perfect candidate for this?
Well, we want to make sure our patients don't have any outstanding serious medical problems. We want to make sure they're in good ocular health. And we also want to make sure that their focusing problems are in the range of those that we can correct with our laser.
So I was
And you were perfect in every way.
All righty then.
Was she better than other patients?
She was...
No, okay.
She was an excellent patient. She was very cooperative. She was nervous, as most patients are, but she was able to do everything we needed her to do to get a good outcome.
Okay.
And the procedure was great.
Okay, well, now we're going to take a look at the procedure. I'm almost afraid to look at this, but if you guys are squeamish out there, then don't watch this.
This is the first time I'll even be
because it's a little
seeing
bit
it.
graphic. It is surgery, etc. So let's take a look at the actual surgery. Describe to us what you're doing.
Well, we do the surgery with just topical anesthetic drops. Here, Lisa's getting some disinfectant on her eyelids. We put some drapes on the eyelashes. And we hold the eye with this little lid holder, which we call speculum. Most people say this is the only part that even bothers them in the least bit. We put a little mark on the cornea. And then what we do is we prepare a corneal cap with this very precise instrument called a microkeratome. And what this does is it produces a very thin wafer of tissue, corneal tissue, that we can reflect away. There you see it being reflected, so that we can treat the interior of the cornea with our laser, which is what we're doing right over here.
That was her actual tissue that flipped
That's
over.
right. And here you see the wedge of the little wafer of tissue being replaced. Now, in 2.5 minutes, that's totally re-adhered. So what we've done is we treated the interior of her eye and reshaped her cornea so that it can focus more efficiently.
And wait, are you awake through all of this?
I was fully
Look, she's blinking her
conscious.
eye.
You would never know I was Chinese from that picture. Look at how big my eye was.
Now, did it hurt?
Honestly, I didn't feel any pain at all. You could sort of feel the pressure. The weirdest thing was seeing these things kind of coming at me, but I didn't feel anything at all. It was incredible.
What about that little speculum thing that opened your eye?
You could definitely feel things happening, but it wasn't painful.
Okay.
So you ready?
And how long did it take?
15 minutes.
See, roughly about 6 or 7
For both
minutes.
eyes?
6 or 7 minutes?
For each eye.
For each eye, I see.
But 15 minutes total. I was
Right.
up and out of there, and I felt perfectly fine. So we're going to try
Let's
this?
do it.
Yeah,
Do it.
take
Okay.
them.
Okay. Maybe we should have a drum roll.
I know.
Can we have a drum roll?
They're gone.
They're gone? Thank you.
Ow. Hold on, my eyebrow's out.
Wow.
And I have... Okay,
You have eyes.
She's Caucasian now.
I had makeup on, and I didn't have to wear those through the whole show. We were just
What's
doing
the
that for
difference
effect,
in what, because you have no contacts on, no
I have
glasses?
absolutely no contacts on. And I have to say, Dr. Fox was so amazing. He was so soothing and calming and walked me through the whole process. And he kept saying, it couldn't be better, it couldn't be better. So it was such a huge testament to him.
Lisa, have you ever been able to read the prompter without your contacts or your glasses?
Never, never. Hold up some fingers. You were there. In the red shirt, you have 5 fingers too. Oh God, please, that's so easy.
That's
anyway.
good. Is this
you, Doctor.
permanent, this procedure?
Yeah, it is
She'll
permanent.
never have to do this again.
It is permanent. Occasional patient needs an enhancement about 3 months. Through TLC, we offer a lifetime commitment.
And no insurance covers this. We have to point
No,
that
for the
out.
most part,
This
no.
is out of pocket.
But I honestly feel like this is one of the most amazing things that's ever happened. I mean, I feel like I have contacts in right now, but I don't feel them at all. So
that's great.
Oh, that's so wonderful.
Thank you, Dr. Fox.
You're
You're the
welcome.
best.
He's a genius.
The best.
He's a
And for more
genius.
information.